Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning has been on infant mortality. The rate at which African American babies die are moving the city of Milwaukee further away from goals set in 2011. Black babies are still about 3 times more likely than white infants to die in Milwaukee, and the city is in danger of not closing the radical or racial gap within the next few years. My next guests represent the Black Health Coalition of Wisconsin. Clarine Mitchell is the Director of Communications and Collaboration, and Jim Addison, he is a project coordinator for their African American HIV/AIDS program and Family Fatherhood Coordinator for the Milwaukee Healthy Beginnings Project. Welcome to the show.
Thank you.
I appreciate you both being here, and we have established up to this point of the show that Milwaukee has one of the worst infant mortality rates in the country. And Mayor Tom Barrett has even said that there are zip codes within this city that have higher infant mortality rates than some third world countries. That's a scary thought. So let's talk about what the Black Health Coalition of Wisconsin has been able to do up to this point when it comes to combating infant mortality in the Black community and provide that necessary assistance to families.
Thank you for giving us the opportunity to talk about this important issue, Andrea, especially because when you opened up and talked about the disparity, Black babies in this community dying 3 to 4 times more so than white babies in some areas of our city. Every time I hear that, it takes my breath away. My heart, stops momentarily, because that shouldn't be a reality in our community. In this United States, it shouldn't be a reality anywhere that we have disparities that mirror third world countries. In great America, it shouldn't be the case. Thus the need for organizations such as ours, Black Health Coalition of Wisconsin. We've been in existence as an organization since 1988, but specifically working with infant mortality since 1998 through a federal grant that we received from Health Resource Services Administration, Department of Health and Human Services. So it's a federal grant that we've been receiving since '98 to be able to combat the disparities. And we've been making a difference because we've been at the ground level, providing intensive case management and supportive services to specifically families who are the most vulnerable, disenfranchised in our community, and often are not able to go and get services through other agencies. And we're able to work with them and provide the hands-on support that they need to help them get through that time frame.
Yes, so since 1998, you've helped save 8,000 babies, and you serve more than 500 families each year with your Milwaukee Healthy Beginnings Project.
So about 500 to 700 families a year that we work with, yes.
So you've recently hit a major roadblock due to federal funding. So if you could fill us in on that.
So as I mentioned, we've been receiving the grant since 1998 from the Department of Health and Human Services, HRSA. We went through our normal process recently to reapply for the grant. And we had no worries with it necessarily, because we've been doing the work since 1998. Each year we have independent evaluations to show the quality, the impact of our work. So we went through the process, applied, and to our disappointment in August, we found out that we didn't get renewed, unfortunately. End of August we found out this, but then we also found out, and this process was a little different when the federal government, they did 2 rounds of grants. They did 1 round, didn't get enough applicants, and did another round. And we applied for both rounds, met the deadlines, met the requirements. Our first grant was approved, but not funded, which made no sense to us, because the government had the funds at that time to be able to award all those who were approved. And that's the major contention with our petition that we have on change.org, requesting the president to hold his administration accountable so that they award us the funds based upon us being approved, and them not awarding us because they went ahead and went to round 2 without fully funding the round 1 applications that have been approved.
Okay, I find all of this very interesting. So we will focus on this petition and how people can help make a difference, but I don't want to leave Jim over there.
Well, I'm okay because if there's no agency, there's no Jim.
What I wanted to point out with all of the things that she has said up to this point, with the difference you've been able to make with thousands of babies being saved and helping out hundreds of families over the years, you worked as the Family Fatherhood coordinator for the Milwaukee Healthy Beginnings Project. So what are some of the things that you were able to do with the funding that you were once receiving, and what's going to change now that that funding has stopped?
Well, by the time the infant and the father makes it to my desk, they've already been assessed by the case manager that's working with the mother and the infant. They've been enrolled. They've been assessed, find a depression screening, so they're trying to find out the general environment that the infant is living in. And if there's a father who is there, then they make a request for that father to work with me, and then that's when I become involved to see individually how I can work with that father simultaneously while the mother is being worked with. And sometimes we do individual case management, sometimes we work simultaneously together just to try to improve the environment that that infant will grow up in. So without that funding, some of the things that we do around technical assistance, around employment, just the environment that the infant is growing up in, that's going to be lost without that funding.
Wow.
The case managers that he referred to that initially work with the families before he gets involved, we will be losing those staff as a result of these funds being taken away from us by the federal government. So that means that we won't be able to continue to provide the intensive case management at the level. We're committed, our organization, our president and CEO, Dr. McManus, is committed to continue the Milwaukee Healthy Beginnings Project, but of course without the amount of staff and funding resources that we have, we'll be crippled to be able to provide at a high level as needed in the community.
So I'm thinking, is this about $700,000 that you had received with this particular grant?
So this particular grant would have been $750,000 on an annual basis. When we applied for this grant, it was already going to mean a reduction from a $900,000 annual budget that we had. So we were already going to be losing $150,000. And we understood that. But then to now go from $750,000 to nothing. And the needs in this community and the work that we do to be able to meet those needs is really a sad time for our community.
So without that money, not only will you be forced to lay off most of your employees and casework for at-risk families, you in fact will not be able to save the number of babies that you've been able to save up to this point. So those at home are wondering, okay, so why did you lose the funding? Or do you even know why? Is that something you're trying to get an answer to?
We pretty much have received answers. It was political. It was where the government, they decided to combine the two rounds of grant application funding processes as opposed to do as they have put in the grant announcements to do grant one or round one first. And because of that, then that lessened the number of dollars that was available for us to be awarded. Excuse me, also there really seems to be a switch on the federal level and elsewhere to really move away from community-based organizations such as Black Health Coalition, who does ground level community engaged work, to really funding academic organizations, institutions, or health departments and others. Not to say that there's anything wrong with that, but there really seems to be a switch to funding others who can do this quote-unquote evidence-based work that doesn't necessarily provide or coincide with what the community needs to be able to make an impact with the numbers that we're seeing.
And you bring up a very important point, because when you talk about the Milwaukee Health Department, you guys have worked closely with all of the different things that are a concern in this city in getting the job done. And even the health commissioner for the city of Milwaukee, Bevan Baker, has said that what you do is vital. So we have to make sure we inform everyone at home on how they can sign this petition and get it to the people that need to see it, so that something may be overturned and done about this situation.
And we welcome that, because this is an opportunity for the community to stand up and voice their concern about infants dying in our community by supporting this petition. It's a petition on change.org addressed to the president for him to hold his administration accountable so that our funding is restored. People can go right to the Black Health Coalition of Wisconsin's website at bhcw.org. Right on our main page, there's a hyperlink that will take people right to the petition, and all they have to do is type in their information and to please spread it, you know, throughout the community with their network, their friends and families, because the more signatures we get, the more of a message that can be put out there to the federal government that these funds need to be restored because they're needed in this community. And we're doing this not just for the sake of our community and Black Health Coalition of Wisconsin, we're doing it for 24 other projects around the country, both urban and rural communities and projects that weren't funded as well as a result of the federal government foregoing the process that was established in their documents.
Wow, so that's what this show is all about. So our city unfortunately has lots of issues, and this is a major issue when you look at the number of babies that die before their first birthday and organizations who really help make a difference. So that is why you're here today. Before we run out of time, I wanted to quickly mention an event that you have coming up on October 22nd. It's a community dialogue with those who work in the child welfare system. So where is that going to be held? And people can get more information on your website, I'm sure.
Yes, and that'll be held at our location, 3020 West Fleet Street. This is the second and a part of a series that Dr. McManus is facilitating regarding the child welfare system, and is very relevant to infant mortality. And as she says that, and Michelle Alexander was recently here talking about the new Jim Crow, how the prison industrial complex is the new Jim Crow, but our boss, Dr. McManus, refers to the foster care system as the new Jim Crow when it comes to infants, because so many of our infants are being caught up in this system and taken away from their families unjustifiably so. So this connects to our issue of infant mortality, or to our work of infant mortality, and we're doing this through our Milwaukee African American Infant Mortality Task Force. Again, we're still committed to continuing the work of infant mortality, whether we have this project or not, so this is one effort that continues that, but the more support we can get with the petition, the more work we can continue to do.
Yeah, and I definitely want to make sure everyone at home knows that there are so many programs and services that you offer on so many different levels. Jim, as I mentioned, works with the HIV/AIDS program that's right there at the Black Health Coalition as well. So we've run out of time, so I definitely want to say thank you both for stopping by and giving us the information you provided today. Clarine Mitchell is the Director of Communications and Collaboration, and Jim Addison, he's a project coordinator for the African American HIV/AIDS program and Family Fatherhood Coordinator for the Milwaukee Healthy Beginnings Project. You can log on to bhcw.org for more information on anything we've discussed today, and that is going to do it for our show. I'm your host, Andrea Williams. As always, I thank you for watching, and I do hope you join us again next week as we take another look at our issues in Milwaukee. Have a great day.